Welcome. My name is Gillian, and today we're here. I've got a group of experts, 2 senior midwives who are experts in their profession, and also a, oral health or dental clinician expert. What do you prefer, Hanny?
Oral health clinician would be fine.
Oral health clinician. And we're going to discuss today why oral health is important for midwives to take consideration of and to include in their practice. So I'd like to hand over to the group to introduce themselves. So starting off, maybe Stacey.
I'm Stacey Gilbert. I'm a clinical midwifery educator. I work at the Royal Women's Hospital. I'm also the graduate coordinator there as well.
Hi, I'm Deborah Pidd. I'm a unit manager at Mercy Hospital for Women in the outpatients department with a special interest in antenatal care.
And I'm Hanny Calache. I'm a paediatric dentist and I work at Dental Health Services Victoria.
Good. And I think maybe the best place to start the ball rolling, as with anything with foundations of midwifery, is about the physiological changes of pregnancy, which all midwives, all student midwives must learn. So, from a midwife's perspective?
Yeah, I can start off. I guess the physiological changes in pregnancy are there to maintain the pregnancy. So there's a number of hormones that impact on pregnancy, including estrogen, progesterone and relaxin. I guess to maintain the pregnancy, but these hormones impact negatively sometimes on oral health. I guess most importantly, as a midwife, we need to know that as estrogen is essential for tissue growth. Relaxin helps relax all of the muscles, so the smooth muscles. There's also some significant suppression of the immune system. So this is part of pregnancy, and the impact that it can have on oral health can be significant.
Yes. Anything to add to that?
Well, not so much to that, but one of the common complaints, problems in pregnancy can be what's commonly known as morning sickness, although in fact it can be all-day sickness, and that is a result of the pregnancy and partly hormonal. But this can certainly have a significant impact on oral health, and in itself is the vomiting and the erosion that can occur from the enamel from vomiting, and which leads us very nicely on to Hanny to actually explain why that's a problem.
Okay, well maybe I can just talk first about how dental caries and periodontal disease or gum disease occur. And just very briefly, in terms of dental caries, or dental decay, you actually need 3 things for dental decay to occur. You need to have some fermentable carbohydrates, which is basically some simple sugars, or very highly refined complex carbohydrates. You need to have susceptible teeth, so teeth that either haven't developed very well or their anatomy is such that it puts them at risk to have dental decay. And you also need to have bacteria. So there are specific bacteria that in the oral cavity that actually produce dental caries or encourage the production of dental caries. And what these bacteria do, they actually feed onto the fermentable carbohydrates and they produce an acid. And that acid actually dissolves the enamel. So then you start to get porosity within the enamel. The enamel changes color. It goes from being white, sort of grayish white if you like, to actually very, very white in terms of the way it reflects the light, so that we can pick early decay before it actually turns into a cavity. The other things that play a major role in that is saliva. Saliva is a very important component in that saliva itself, it clears food debris and it clears the acids, but it also has buffers within it that actually buffers the acid. It has fluoride in it, so if you're in a fluoridated community, it will have fluoride that will actually be secreted around the teeth, and that fluoride will help to remineralize the demineralized enamel. So what we say, when you get calcium and phosphate drawn out of the enamel by the acids, the saliva's got calcium and phosphate in it, and it actually can replenish it again. So basically, that is how dental decay occurs. If we think about gum disease, a similar sort of process. There's another group of bacteria that actually can cause gum disease. They release toxins that the gums then react to it. They get inflamed, and they can, if that keeps going, then they can become infected. So for gum disease to occur, you need the bacteria, but you also need a susceptible host. So if you as an individual have diabetes or have an immunodeficiency or anything like that, you are much more susceptible to gum disease and will react in a more severe way to the impact of the toxins from the bacteria. So that's just very simply and very quickly how dental caries and gum disease occur. Now, Deb, you asked me about physiological changes and how they impact on oral health. Well, basically, and you were talking about morning sickness. So with morning sickness, when you actually vomit, some of the gastric acids come into the mouth, and therefore the pH level of the mouth drops, and so it becomes acidic. And we were talking earlier about acids from bacteria dissolving the enamel. Well, that's exactly what happens. The enamel then will start to get calcium and phosphate withdrawn from it by the acids. The enamel surface becomes soft. So what we need to be careful of is that we don't rush to the bathroom and pick up a toothbrush and brush our teeth straight away. Because that enamel has become soft, we can actually be removing layers of enamel by brushing. So we would be recommending that you actually rinse your mouth and not brush for at least half an hour to an hour after you've been sick. And there are other things that we can do, and we'll talk about them later on maybe.
But it is such an important message, isn't it, to get across about that, because I think intuitively everybody would rush to do exactly that, clean their teeth. Yes. So that's, really important.
Yeah. Hanny, you did discuss about the discoloration of the teeth, and I guess my role as a midwife is that's probably some of the things that I may see in the antenatal clinic of identifying, those early stages of,
and so if you can identify that, that would be a good message to give to the pregnant woman to actually go and see a dentist.
Yeah.
The other thing that you can also recognize is bleeding gums. So if the your client sort of says to you that when I brush my teeth and my gums are bleeding, that implies that there is an inflammation and early signs of gingivitis, which is the very early signs of gum inflammation.
So in terms of that, so we were just going to actually just talk about what we actually do see in clinic, and I find as a general rule, you don't see as much tooth decay as I used to when I started to do my kind of 30 years ago. But we don't look inside people's mouths, do we? And that's the thing. So you're just looking here when people are talking. Although, Stacey, there are certain groups, aren't there?
I think we certainly need to be aware of there's many risk groups, and particularly I notice at the Royal Women's Hospital we have specific clinics for women who have drug and alcohol problems, and we might see women with missing teeth in that sort of clientele. Other groups of women that we might see sort of some missing teeth or some oral health problems, I guess, are the refugee women or women who maybe don't have access to good oral hygiene and dentists, I suppose. So,
I suppose one of the main factors too is that Australia and Melbourne in particular is fluoridated, and so the fluoride in the water has reduced the level of decay across the whole population.
So obvious, isn't it? But getting back, but it is really common to see inflamed and bleeding gums. It is so common. So, Hanny, how can we identify between, say, the gingivitis or the periodontitis? How can we as midwives?
I think as midwives, you probably will only be able to recognize gingivitis. Periodontitis is the next stage. So what happens is that the root of the tooth is actually embedded within bone, and in the bone then there's ligaments that are attached the tooth to the bone, which we call the periodontal ligament. Now what happens when gum disease advances is that you get bacteria sitting around the gum line, which cause inflammation of the gums. But if that bacteria is not brushed away, then the toxins that are secreted by the bacteria are actually then break down the attachments between the root surface and the bone. And so you start to develop a pocket, what we call a pocket, between the root and the bony tissue for bacteria to actually go in to that pocket. Now you won't be able to see that because it's under the gums. So if you are concerned and there is evidence of bleeding gums, the advice is to actually to go to a dentist. And it is quite safe for a pregnant woman to go to a dentist.
And I suppose we heard what Stacey said around one of the physiological changes because of pregnancy is the reduced immunity to infection.
And so pregnant women are much more susceptible. So you will find that with pregnant women, they tend to get more gum disease than when they were not pregnant because of that increased susceptibility, which means that then they've got to be more meticulous about keeping their teeth clean. So the habit has to change. So they may have been able to control it while they were not pregnant, but once they're pregnant, that same habit may not be enough to actually stop the disease from progressing.
And I think another, what I'm also interested in is around the role of saliva. And I think one of the changes also in pregnancy is that there can be a reduction in saliva production.
Right. And I'm sure that that's related to hormone.
Yes.
And so, as I said earlier, saliva is really important that would be for dental caries. So if saliva is turned off or much reduced, then it doesn't have that clearing effect, it doesn't have that buffering effect, it doesn't have that remineralization effect. So therefore you are at greater risk of developing tooth decay.
So it's interesting, Hanny, that you talk about, all of these risk factors, and I guess that I know from my own experience of working with women in the antenatal setting is that women aren't going to see the dentist. I guess there is a fear around firstly going to see a dentist, that sort of fear that's come from childhood, I guess, but also I guess there's that kind of fear around the safety of going to see a dentist while you're pregnant, so fear for the child, I guess.
Well, there is that fear not only amongst women, but it's also with some dentists who feel that there's a risk of them to actually provide treatment to pregnant women. Now, it is quite safe for pregnant women to go to the dentist.
And that's based on evidence, isn't it?
In the literature it's been shown, and there's been a lot of research to show that. If there's an emergency, so if a pregnant woman has a toothache or has an infection of some sort, it is much better to actually have that dealt with, because the infection itself may have more adverse effects on the pregnancy and on the developing child than the actual treatment.
Which actually leads us back to just a point which we need to make, which is just about the general process of, so it's not just actually about the tooth problems in itself, it's actually about what else could come from having the tooth decay, isn't it? So in terms of that, we know that infection, inflammation is a risk factor for going into premature birth. So could you just tell us some of the evidence
on that?
On the periodontitis?
Well, there's evidence now that is showing an association. It's not a true cause and effect, but definitely an association between having periodontal disease in pregnancy and preterm birth, and also low birth weight of the child at birth. So that is something that you really don't want and you want to avoid. So it's really important that pregnant women do attend the dentist to have their periodontal disease managed. And as we said earlier, you're not going to be able to see, as midwives, into the pocket that's been developed between the tooth and the bony tissues. You need a dentist or an oral therapist or an oral hygienist to actually be able to go into that pocket and clean out all the bacteria and hard plaque that has developed in there, because the more that is, the more the inflammation will continue. And there's been research that's been done to show that pregnant women who have had their what we call scale and clean, which cleans all that stuff out of the pockets, have less of a chance of getting preterm birth or low birth babies. So that is actually really positive.
It was interesting. I had a phone call yesterday from a woman who rang to say that she had terrible toothache, and could she take, and it wasn't being relieved by Panadol, could she take her grandmother's very strong Panadine Forte? And so I said, well, obviously one is, as midwives know, if you need something for pain relief that requires more than Panadol, you need to come in and see somebody. But the other thing is, you actually need to go and see the dentist.
Yeah, that's really important.
You've really got to go there first.
Because having said that it is quite safe to go to the dentist, there are things that you have to be careful of. So not all medications are safe. Whereas local anesthetic is, so if you're having your teeth numb, surgical treatment, that's safe. Some antibiotics are safe, some are not. X-rays are safe as long as protection is actually provided in terms of a lead apron to protect the baby and the woman, and also making sure that the X-ray beam is also directed away from the womb, and that's fine, and that occurs quite naturally with dental treatment. So yes, so there are certain things. So it's really important that they attend the dentist. For emergency, they can have emergency treatment anytime, even in the first trimester, and that's really important. But during the second, any elective treatment can be deferred to the second or third trimester. The second trimester is the safest, really, from a comfort point of view for the pregnant woman. In the third trimester, the baby is getting quite big, and just positioning the patient in the chair may cause some discomfort, but that can easily be addressed by allowing the pregnant woman to just turn a little bit towards the left-hand side, or have a pillow or a cushion put in under her right hip or something like that to assist her, so that the weight of the baby is not pressing on her inferior vena cava, which actually will stop the blood from going from circulating.
But this is I think, a really important issue for midwives to reassure pregnant women that it is safe to go to the dentist, because I think there's a lot of myths and misinformation out in the community. Hanny, you talk about the saying, for every pregnancy you lose a tooth, and that in the past...
I don't talk about that.
No.
That's actually...
No, it's a myth. It isn't. But it used to be, and it probably was the case. It probably was the case a long time ago.
Yeah.
But
we're trying to avoid that, aren't we?
We can understand that you talked about relaxin. And relaxin, you said, relaxes the muscles. So actually the periodontal ligament incorporates muscular tissue as well, and so the relaxin relaxes those muscles as well, and the teeth can become a bit loose during pregnancy. But once the pregnancy is over, everything settles, so people might think that they're going to lose a tooth. The other thing we didn't talk about is that during pregnancy too, you can end up with what is known as a pregnancy pyogenic granuloma, which is a swelling of the gum that occurs can occur during pregnancy in 1 to 5% of the pregnant women, where it could look really ghastly. It's also known as a pregnancy tumor, but actually, if you can keep it clean and as healthy as you can, that will resolve completely once the baby is born. Sometimes it can grow and become quite big. Then at that time you need to see a dentist and might have to have it removed if it starts to interfere with your ability to chew.
And what does it look like? So is it just like gum tissue growing
It's like a little balloon, I suppose, and it's fiery red, really red, and looks really ghastly. But actually it will resolve itself.
Right, okay.
But that's, you say, about 1 to 5%.
Yes, a small number.
But I think I've seen that, but I've just associated that just with the general swelling, and it looks a little bit worse on
and I guess that's
than not.
An example of estrogen, that whole tissue growth, the impact of that, and that can be one of the side effects, I guess.
That also doesn't it also makes the blood vessels more permeable?
Yes.
So that fluid actually can seep out, and that's why you get that swelling.
So I guess, as healthcare professionals, as midwives, I think that there is certainly a lack of awareness of our role, and, you know, just getting that awareness out to other midwives that it is an important part of our role. And I guess, you know, many people may not be aware of the Department of Health released a clinical practice guideline, and that actually in there is, you know, it tells us that oral health promotion is part of our role as midwives, and it is within our scope of practice to discuss and to make women aware that oral health is an important part of you know, maintaining you know, your overall general health in pregnancy.
And that's kind of happening in the States, that there's been this real focus on oral health is everybody's business who is involved in the whole obstetric process, from antenatal to delivery to postnatal care, and that's not just midwives, it's also the obstetricians.
Yeah.
So internationally there is this move that, you know, oral health is not the domain of the dentist or the dental therapist, but is in everybody's business.
Well, oral health is part of general health. I mean, it hasn't been considered as part of general health for a very, very long time.
That's right.
Whereas
yes.
it impacts quite dramatically on oral health, on general health, I'm sorry. So therefore, I mean, all the diet-related chronic diseases that we have, such as cardiovascular disease, cancer, diabetes, etc. I mean, if you can't eat, you're going to get diet-related diseases. So if you can't eat the right foods, and you don't get the right nutrition. So it's really a very important component, and we're seeing more and more associations and relationships between different oral diseases and cardiovascular disease and diabetes and gastrointestinal cancers, etc. There's relationships that are currently being demonstrated.
I guess we've kind of talked about here the physiological changes of pregnancy do impact on oral health, and that's why it's important for the midwife in antenatal care to play a role. But you know,
it can be quite small. That was the thing that struck me when I did your course, which was terrific, and it is just really quite simple. So instead of thinking like, oh my goodness, not another thing to talk about. And Stacey, so we were talking about that the other day in terms of just how easy it is just to,
I mean, look, you know,
have that conversation.
For those midwives who, you know, particularly in the booking and visit, you know, you talk about a range of different things and just implementing it into your conversation with the woman. So, for example, when you're talking about, you know, diet or cravings, that type of thing, you know, are you eating a well-balanced diet? You know, you can kind of talk about, okay, well, you know, when was the last time you went to the dentist? Are you experiencing any pain? You can talk about, you know, cravings, for example. Are there particular foods that you're craving? You know, whether that be, you know, sugary foods or, you know, associated, I guess, with that nausea, the morning sickness, I guess, which can be all-day sickness, but trying to overcome that. And a lot of people would, you know, maybe suck on a sweet to try and overcome that nausea, and how that can tie into oral health.
Which is the worst thing, isn't it, Hanny? If you're saying if you're vomiting and then you've also got that sweet thing, you're creating the perfect storm, aren't you? And so just that absolute importance there of, and for me, again, since I did your course, it's terrific to be able to say to people, and I confess that I just didn't know. And it's such an obvious thing. So the first thing to talk about with somebody who is experiencing that, well, the hyperemesis, the morning sickness or the all-day sickness, is just helping them manage what they need to do after they've vomited.
And what do you tell them?
Well, it's about having a glass of water, just sort of rinsing their mouth out. And can they have a drink of milk, Hanny? That's one of the things I'm just trying to remember whether that's
they
an
can
okay
have
thing.
milk. Milk would be better than any sweet drink.
Any sweet,
when it's got calcium and phosphate in it.
Yeah,
so
that's what I was
help,
thinking. So and then just absolutely waiting for an hour. Half an hour?
Half an hour to an hour. The longer you wait, the better. But also we sometimes recommend that they put a teaspoon of bicarbonate soda in a glass of water, and that will help to neutralize the acids as well.
But I suppose it's trying to get women not to think, oh, I need to brush my teeth to make
Most
my
important.
mouth fresh.
That's what you would imagine.
Yeah, that's what you would do.
The
but
other
it's not
thing, Hanny,
right
is that we'll sometimes get people who find that they actually struggle to clean their teeth because it makes them gag, and then they'll end up having a vomit. So what do we suggest for women like
well,
that?
if they're finding it, well, one would hope that that would only be for a short period of time. So what we would recommend is that they actually get the benefits of the fluoride toothpaste by just getting some toothpaste and rubbing it on their teeth. And that will help if the brush is what they can't tolerate. We need to brush to remove the plaque from around the margins, of the gingival margins or the gums. Without brushing, we're not going to be able to solve that problem. But hopefully, if that is just for a short period, then you can actually start brushing afterwards. And the early signs of gum disease are totally reversible. But once it gets into periodontal disease, where you start to get breakdown, that's when it's not reversible.
So that's why they've got to be really careful. Even though they might make gag, they need to get the back teeth and make sure that they're getting the plaque.
They just need to get the fluoride in there to protect their teeth against the the actual reflux or vomiting. But they really need, when they're absolutely able to, they can then start brushing.
And it's also about, you don't need a big brush. You can have a smaller head, and I think I use a child's head, but and a soft brush. But the importance of remembering to brush your teeth at night time, really. If you can't do it first thing in the morning after you've had breakfast because of that gag reflex,
because the other thing too, sorry to interrupt you, Gillian, but one needs to remember that at night time saliva almost switches off completely.
That's right.
Well, it reduces quite significantly, and so the protection of that saliva is not there during the night. So that's really important.
Yeah, I think just looking at my role as a midwife and, just simply asking those questions of, have you been to the dentist lately? Do you have any pain? If a woman identifies, Hanny, and that she's, oh yeah, actually I do have a sore tooth, and my role is to say, okay, well, look, we need you, my recommendation would be to go to a dentist, but, she might not be able to afford it. So what's some of the things that we could possibly recommend for her?
Well, she can attend the public dental service or the public community dental program, and we have a policy to support pregnant women where they are considered to be a priority group. So it's pregnant women who are on a healthcare card. By being a priority, that means that they don't have to wait. So it's not, when you go to the community clinic, generally you put your name down and you put on a wait list and you wait. Whereas the pregnant women will be given the next available appointment, so they can go publicly if they can't afford to go
And
privately.
these are pregnant women who have a healthcare card. Is
Yes,
that
they
right?
have to have a healthcare card.
If they're refugee or asylum seekers.
Oh, absolutely.
Yes.
So we've got a number of priority
it's not
groups.
open to everybody.
But
if
the woman is pregnant, if she's on a healthcare card, if she's of Aboriginal background or of refugee background, they will be given priority.
I think that's something that is important in our role as midwives.
Yes.
I guess, we also need to get out to the midwives who are working in the antenatal clinic that we don't expect you to remember all this information. That there is actually the website that they can visit to refresh their memory, and then there's lots of good and useful tools and fact sheets that we can actually give to women. I think that's really important.
Our website
we can make available our website. I mean, it's very straightforward. It's dhsv.org.au, isn't it?
That's right. Yeah. And at the top there's some tabs, and there's a professionals tab, and if you just run the cursor over that, it lists a number of professions, and midwives are there. And if you click on that, you'll have information about the course that Deb was talking about, which is actually being developed by the University of Western Sydney, which is for midwives around oral health. But there are also information for midwives to share with their pregnant women who are their clients.
There's some terrific documentation. There's some really lovely, very things that you've sent us. Nice, simple information sheets for health professionals, and which are actually easily read by women too.
Yeah, but just to where to find, because I know if you're a midwife at the Mercy or the Women's or out at Sunshine, you may not know where the local public dental service is, but on that website that you mentioned, Hanny, www.dhsv.org.au, there's find your nearest clinic. And if the midwife is lucky enough to have a computer that has internet access, she can quickly just type in the postcode or the name of the suburb that the woman lives in, and it lists the nearest public dental clinic. And there are over 80 public dental clinics throughout Victoria, and it is much cheaper if the woman doesn't have her own private dentist, but there are certain criteria.
There's a lot of actually very valuable information on that website.
Yeah.
Apart from just what's being dedicated to midwives. So the messages in general are there messages across the board. It's just that for pregnant women is that they are more susceptible to getting oral disease, and also to remember that it's not only the pregnancy that makes them more susceptible, but then oral health issues have an adverse effect on the outcomes of the pregnancy. So it's like a vicious circle that goes on that needs to be stopped.
And I think us as midwives, we're in that perfect role and have that perfect opportunity when women become pregnant, they're quite often open to changing just their general health. So, their diet may increase, they want to quit smoking. So it's a perfect time to get in there and talk about brushing your teeth twice a day, because in fact, something so simple that we think is really simple that a lot of women do, they may not actually be doing it. So I think we're in that really optimal position to actually make a difference.
But also all those risk factors you just raised have an impact on oral health. So smoking affects gum disease and also dries the mouth. So in the long term affects tooth decay as well. So the messages are not really much different. And they would be helping both, having a good pregnancy outcome as well as having good oral health.
But also, as midwives, women, they do trust us. I mean, that's a well-founded trust. It's interesting how people will ring and, get permission to go to the dentist, or even, I've been to see my GP and I've been told to take antibiotics. Is that okay? So we are in that very fortunate position to be able to positively influence by people by reassuring them that it is absolutely safe to go to the dentist. And really an important thing to do. So that is something, that we can, really use our influential powers for good.
And I think, that the key message is that oral health is part of, midwives can play a role in oral health promotion, and particularly in antenatal care. That's a perfect opening, isn't it?
And it's just even as simple as encouraging women to have a dental checkup during their pregnancy. It's that easy, and
asking that question.
And
have you seen your dentist?
Because
recently?
I guess breaking down that fear that women think it's unsafe, and just making them aware, I guess, is really important. So,
and then also to dispel, in terms of not dispel, but just really make sure that they're careful with managing anything where they are feeling like, well, I'm craving it, so it must be an okay thing. So not to be just sucking on the lollies and drinking juice, to sort of find other ways of just managing that.
And there's a myth, isn't there, that you have to address that craving?
Well, the thing is, it's an interesting thing, and maybe this is something for another time to go into the evidence that's around it, but intriguingly, sometimes it's actually having a low iron count, and so if you say something craving like, it's bizarre because people can actually crave chomping on ice, and that is known to be because you've actually got low iron stores. Now, don't ask me to go into all the sort of the complexities of why that is so. And so somebody who's, say, craving oranges, it may be that they're trying to get more vitamin C and to potentiate the uptake of iron. So it is an important thing, just because something it's not necessarily exactly what it seems. So to sort of, so it's an important thing is a holistic thing, just to be aware that if you're craving something like that all the time, it's probably worth mentioning it, so something where we can sort of do a bit more background investigation into that.
And some other advice too with regard to pregnancy and the reduction in saliva is that you could advise your client to actually chew on sugarless gum, because that actually will promote saliva. It will stimulate saliva, so that can help as well.
I guess you can also encourage women to just drink, tap water, replacing, like a soft drink or a juice. With just, just to stay hydrated. Just drinking simple tap water is a better option.
And eating an orange instead of drinking orange juice.
Yes.
Things like that.
Yeah.
Well, importantly, all the soft drinks are very acidic. So if you've got a lot of acid in your mouth anyway because of vomiting or whatever, then the soft drinks are going to make things absolutely worse.
Yeah, that's right.
Water is the best drink, and milk, as you mentioned earlier, would be very good too.
Yeah. Well, I think we've kind of covered everything, but I hope that you found that discussion interesting and has kind of, as midwives or student midwives, you will now begin to really think carefully about oral health and think about how you can include it in your practice, because we've heard from midwives across Victoria actually, who have recently done some training on oral health and pregnancy, that having an oral health assessment within the first antenatal booking visit is within the role of a midwife, and so it's
quick and simple to do.
And quick and simple to do. So we encourage you to think about oral health and to include it in your practice. So thank you, everybody.
Thank you. Thanks so much.